The first question is whether corticosteroids are the only ones that will cause a decrease in bone mass. Well, I already say no. We know that glucocorticoid-induced osteoporosis will be the most common cause of osteoporosis secondary. It has been observed that glucocorticoids cause an accelerated decrease in bone mass, which can already be evident within the first 6 to 12 months or even earlier if higher doses are used. Already in the first few weeks, there is an increase in bone resorption due to increased expression of rank ligand. And yet, the main mechanism, it's shifted a little. The presentation. The main mechanism by which this bone loss occurs. It happens because there is a decrease in both the number and activity of osteoblasts and osteocytes. It has been observed that glucocorticoids alter the bone microarchitecture, especially at the level of trabecular bone. That's why it is said that the most common fracture in people taking glucocorticoids are vertebral fractures. And here we have another group of drugs that can cause a decrease in bone mass, such as aromatase inhibitors like letrozole or anastrozole, GnRH analogs, or tamoxifen. It has been observed that they can cause a rapid loss of bone mass, which would increase the risk of osteoporosis and the risk of suffering a fracture. And this is due to the inhibitory effect on circulating estrogens, which would appear within the first few weeks. On the other hand, androgen deprivation therapy used for prostate cancer. It has also been observed that it can cause a rapid decrease in BMD, leading to a higher risk of fractures. And that's why the guidelines recommend that in these patients, calcium and vitamin D supplements should be started, a bone densitometry should be performed, and treatment should be initiated either with bisphosphonates or with denosumab in patients who are at high risk of fractures. Other drugs that have been shown to reduce bone mass are anti-epileptics, especially phenobarbital and phenytoin. It has been observed that these induce the production of cytochrome P450. And what this does is, it inactivates the synthesis of vitamin D, which leads to a decrease in calcium absorption and the development of secondary hyperparathyroidism, which would accelerate the loss of bone mass. And others as well, such as valproate, which has been shown to, which to a lesser extent, will increase the risk of fracture. Antipsychotics as well, through an increase in prolactin, can reduce bone loss, or rather they can cause a loss of bone mineral density, BMD, and thus increase the risk of fracture. And antidepressants, such as SSRIs, also through a mechanism that is not yet understood, have been shown to potentially cause a loss of BMD. And this effect will be greater if the patient has been on high doses and for a longer duration of treatment with it. Other drugs, such as proton pump inhibitors, have been shown to reduce calcium absorption by inhibiting gastric acid secretion. Also, for example, anticoagulants like heparin, when used over a prolonged period, can inhibit osteoblasts and reduce osteoprotegerine, which would lead to an increase in rank ligand expression, resulting in greater differentiation of osteoclasts. It has been observed that the risk of fracture is dose-dependent and is associated especially, not with heparin, fractionated. And then, other drugs that can cause them include euthyrox, loop diuretics, or also chemotherapy, such as